What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, September 14th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there. Each of them carry different risks. COVID, it's been around since 2020, maybe even 2019. Yes, there's some people that may have had it in 2019. It's caused a lot of damage to our health, not just in the United States, all around the world. COVID can go on to cause long COVID. There's over 200 different symptoms of long COVID. Long COVID's one of the things we are actually going to talk about today in just a little bit for those who may be new to, maybe you had COVID for the first time during this summer wave, and now you're having some new issues, and you're wondering, could that be long COVID? Well, we'll talk about that in a little bit. We'll talk about some other viruses as well. So if you're new to my channel, subscribe down below, give this a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Alright, it may be Saturday, but I actually have quite a few things I want to share with you. Starting off with a few news stories, then I want to take a little look at some of the symptoms of long COVID for those of you who may have just had COVID for the first time and are wondering, are my lingering symptoms from COVID? Well, we'll get to that in a little bit. Then we're going to look at some data. Then we're going to take a look at emergency department visits for people diagnosed with COVID, and of course some state data as well. So starting off here, this is a post on X from Sci-Fi. It's actually a thread, and there's a few things I want to point out from this. He put, update, CDC releases new COVID positivity data, flat or downward in all HHS regions except 2. In other words, region 2, which is the New York, New Jersey metro region that shows a large spike. I don't know if this is legitimate, if it's a data error, but yeah, there was a large spike in the COVID positivity rate this week in this particular region. And he put 19 hours ago on X, breaking, the CDC reports the largest COVID spike in the New York, New Jersey region since the week ending in January 1st, 2022, the peak of the Omicron wave. And take a look at this. We can see it pretty clear here. There was a large spike. We'll have to see if the CDC corrects this, if it's real. I mean, obviously, if this is real, there's something concerning. But right now, it's just something we're looking at. It's the only region that's doing this. And for the most part, the majority of the United States is now declining from the summer surge and declining at a faster pace, which is some good news. In other virus news, CDC updated the influenza-like illness, and he shows the chart here, and take a look at this. And that one for flu, the positivity rate is 0.43%. It says influenza-like illness activity is 65% higher than in 2019. Brings me to my first long COVID point of the day. One thing COVID can do is weaken your immune system. And by weakening your immune system, you can catch a lot of other viruses easier and more frequent. Hence the rise in influenza-like illness activity being 65% higher. And reminder that influenza-like illness activity is not virus specific. I mean, you could have it could be any different type of thing. You could catch colds more easily. You can catch a whole bunch of things a lot easier after having COVID, and that's not always even the reason why people are sick. Sometimes the illnesses are just going around at higher rates. Virus positivity rates for the week ending in September 7th, and you can see here there's a whole bunch of different ones. And the positivity rate for RSV, that's one we want to take a look at, because pretty soon there'll be a spike in RSV, or a rise, or seasonal wave, I should say, and that's at 0.28%. COVID is at 14.90%. Wow, that's pretty high. Alrighty, we're not going to look at any more of this. Wastewater will be our big focus tomorrow. Moving on now to this. This is in Australia, and it says here the KP.3.1.1 variant is the variant that is dominating in Australia at this time. Moving on, Italy. Someone asked about Italy the other day. I can only post on certain countries. Really, it could mean any country around the world. As long as I can find data, that's when I can post on a country. If there's no data on a certain country, or if I can't find anything on a certain country, unfortunately, I can't say much about your country. In this case, we can say something about Italy, because here's some updated numbers right here from Dennis the COVID Guy on X, formerly known as Twitter. Italy COVID infections have decreased, but deaths increased by 30% in the last week. From September 5th to September 11th, reported cases are 9,670. That's down by 20%. Still a lot of cases. I mean, in a day and age where most people either don't test or they use the at-home test, which doesn't get reported. I know UK used to have the Rose system. It used to have some sort of system. Does Italy have anything? I don't think so. Deaths, this is not good. 97 deaths were added. That's up by 30%. The positivity rate is 11.1%. That's down by 3.3%. And 16 cases per 100,000 right now is about what the rate of cases are in Italy. Russia, we do have news here as well. Yes, some international news. Good that we can finally at least get something from these international countries today. COVID-19 cases skyrocket in Russia due to new variant, which is to be expected as everywhere else around the world has dealt with all this variant soup that has been going on throughout the summer. Some countries, certain variants took over more than others, but for the most part, it's just pretty much the theme. Everyone has dealt with a wave over the last few months. Now Russia is dealing with their wave. All right, let's start to ease our way into long COVID discussion for just a little bit. First off, new study, risk factor for developing Alzheimer's disease increases by 50 to 80% in older adults who caught COVID-19. If you catch Alzheimer's, if you go on to develop Alzheimer's after catching COVID, that is a form of long COVID because it's a issue that you developed post-COVID or a post-COVID complication. And let's face it, there are many people out there that deal with post-COVID complications, and long COVID is terrible. Alzheimer's is absolutely horrible. I mentioned the other day, I cared for a relative, my grandmother, here in Philly. Dealt with Alzheimer's for several years. She was early stage when I first started taking care of her. Then it started picking up the pace, and it's just a horrible disease. And unfortunately, COVID can go on to increase your chances of getting it by 50 to 80% in older adults. Trust me. Listen to someone, meaning me, who has cared for someone who dealt with Alzheimer's. Please try and avoid catching COVID at all costs. You do not want to go on to develop Alzheimer's. I also currently have neighbors who are currently dealing with Alzheimer's right now. It is a very serious disease. And this is, I mean, if you're 65 or older, you could go on to develop this. We've even seen a few rare cases as of lately where people younger have gone on to get Alzheimer's or some form of dementia. Yes, it's happening at younger ages. Speaking of long COVID, let's talk about this for a second. We just had a massive surge here in the United States, and really, many countries around the world have had a massive long duration wave. This wave in the United States started back in May, and well, here we are, September 14th. Yes, we're on the backside of the wave, but backside is equally as risky. We've had Mayor Eric Adams of New York City test positive. We've had a lot of people test positive. Janet Yellen tested positive this week. I mean, this is the backside of the wave, and we're still coming up with a lot of celebrity positives. Of course, there were a whole slew of them throughout the summer. I think there were more this summer than I reported on last summer, but I did not go back to check that, but it just seems like it's been a long summer. The point I'm trying to make is a lot of people just had COVID. If you're clicking onto this video, watching my video here today, you just had COVID, and maybe you're having some sort of a new health issue that's popping up. Think about it. Did you have COVID? I should correct myself. The way I should word this is, if you had COVID this summer, are you having a new health issue? Or if you are having a new health issue, think back. Were you sick at some point this summer? Well, think about it. You may have had COVID. COVID can cause up to 200 different health related issues post-COVID. And it says it right here. This is from the Mayo Clinic. In research studies, more than 200 symptoms have been linked to long COVID. Symptoms may stay the same over time, get worse, go away, come back. It hits everybody at random, and it can also go on to develop dozens, heck, maybe hundreds at this point, different illnesses, syndromes, long-term conditions. I mean, there's a lot of different things. And if you previously had something prior to COVID, meaning being you're compromised, you're at higher risk, that can increase your chances of going on to develop long COVID. Here's just a few of them. We're just going to go through a few of them on the list. You could have sleep problems. You could have shortness of breath. Hey, shortness of breath. There's something I deal with post-COVID. Cough. There's something I deal with post-COVID. Headache. Yeah, I get that once in a while. Today I've had a headache because, well, it's a bad air quality day, and because there's wildfire smoke in the air, it's causing me to have a headache, and it's causing me to have a scratchy throat because of the air quality being bad. This air purifier will go back on after today's video. The one downstairs already is on. And you could have irregular or fast heartbeat, digestive issues, heart disease, mood disorders. I'm going to be honest with you. I've never really mentioned this too much, but mood disorders and anxiety, I think that's one thing I have gained post having COVID back in 2020. Do you notice that? Let me know. Any of these things down below, something you're dealing with? Stroke, blood clots, diabetes. I mean, all these different things are possible things you could have post-COVID. And like I said, there's over 200 of them. We just named maybe 10. Diabetes. There was just a new study on it yesterday. There's several studies out there. I have 7 of them on my site right now. I thought I had more than that. There will be more coming because I know there's several that have been posted out there before my site has started. I want to find them. I want them added on there because you need to be able to find this information. Datareport.info is my site. Alrighty, moving on. Again, long COVID is a serious disease. I will link this in today's thread so you can go read more about long COVID. We only mentioned just a handful of symptoms. There's several of them out there. Some people get it so bad, they wake up for the day, they do one little thing, then they have to go back to sleep. Others even have walking issues post-COVID during long COVID. Yes, it's really bad. Alright, moving on. Heat-related illnesses, not much to say about this. It will update again on Monday. There are still several counties in the country of the United States that are dealing with heat-related illnesses. Pollen levels for today, let's refresh this. 47% of the country is in the medium status. The Mid-South is dealing with some red areas today. Air qualities. As I mentioned, we have wildfire smoke issues here in the Northeast. I mean, it's only coming up yellow, but you can smell it outside, and it is affecting my throat today. In fact, I can actually tell you a quick story. Because of the wildfire smoke, we have railroad behind us. Someone thought there was a fire on the tracks. No, there was no fire. They were just smelling the wildfire smoke, so the fire department came out and the whole 9 yards. Taking a look at this is my other account, and it is Climate Data Report. You can learn about anything climate and weather there. Taking a look at Philadelphia, 876 EMS calls were reported yesterday. Taking a look at EMS calls right now in Montgomery County, Pennsylvania, there are a few to be had. Heat exhaustion. Hey, there is a heat-related illness. Look at that. Limerick Township, Montgomery County. And finally, and I do say the word finally, Chester County is less busy than earlier today. There were so many calls, a lot of EMS standbys. I'm assuming that is fall sporting event related. Taking a now at emergency department visits, but before we do this, let's get to a few notes that we have to mention. And this is data coming from CJS 83172, and some of this does have to do with hospitalizations. I'll show you in just a moment. Florida this week, or I should say Florida yesterday, reported 1,062 new cases and 41 new deaths reported in yesterday's update. And for the week, they had 10,168 cases and 278 deaths reported this week. That's ridiculous how many deaths Florida's still having. New Jersey, 969 new cases reported yesterday and 4,997 new cases and 7 deaths reported this week. New York, 1,985 new cases reported today and 11,732 cases and 58 deaths reported this week. Virginia, 1,055 new cases and 1 new death reported to their open data page yesterday, and 6,507 cases and 15 deaths reported this week. California added another 9,417 new positive tests and 108 new deaths this week. Iowa, 28 CDC reported deaths over the last 2 weeks. Illinois reported 448 new CDC reported hospitalizations, including 87 from last week and 43 new deaths. Again, that's Illinois. Missouri reported 27 new CDC reported deaths. Mississippi, 25 new CDC reported deaths. New Hampshire, 8 new deaths, a substantial number for that New England state. Oklahoma, 165 new state reported hospitalizations, including 56 from last week, and 13 new CDC reported deaths. Pennsylvania, wow, this is bad for my state, really bad. 720 new CDC reported hospitalizations. 48 new deaths. Okay, deaths came down some, but this is with a lot of hospitals in Pennsylvania. I know for a fact there are definitely hospitals in Pennsylvania that are not reporting. Remember, we used to report Mount Nittany Hospital in Center County, Pennsylvania, and they collapsed. They did away with their dashboard. It don't exist anymore. I question if they're still even reporting. Well, they'll be required to in November. 720 right now, that's absolutely terrible. I think we may see deaths go up again just because the number of hospitalizations went up again. South Carolina, 22 new CDC reported deaths. Texas, 5,898 new cases and 61 new state reported deaths. West Virginia, 2,925 new positive tests and 10 new CDC reported deaths. At least we can say out of all these states, yes, the cases are starting to come down, but again, it's another week. Deaths are they're going to be over 1,000 this week. It's not good. All right, quickly going through emergency department visits. Reminder, these are people diagnosed with COVID showing up. All right, United States overall is dropping. Alabama is dropping. You're below 2%. Alaska is dropping. Arizona, Arkansas, California, all dropping at this time for the most part. The majority of places are dropping. Colorado is dropping at this time. Connecticut was dropping. And then if you look really close here, Connecticut's starting to go back up once again. It's just the ever so slight rise. It's nothing major. Delaware is dropping at this time. Significant drop in D.C. now, District of Columbia. Florida is really dropping. You peaked we'll say about a month ago, you peaked. Georgia is rapidly dropping now. Guam is dropping. Hawaii is dropping. Idaho, maybe finally dropping, but you're late to the party and dropping. You might actually even still be bouncing around a little bit. Illinois is dropping. Indiana is dropping. Iowa is dropping. Kansas, Kentucky, Louisiana, all dropping. And look at this. Louisiana is now rapidly dropping after peaking over 4%. Maine is finally dropping. Maryland, Massachusetts, dropping at this time. Michigan, Mississippi, look at Mississippi. Your peak was over 4%. You are finally dropping. Montana, you're not really dropping yet. Not good to see that. Nebraska was dropping, and hopefully it's about to drop faster. Nevada's starting to drop. New Hampshire was dropping. Now you're kind of bouncing around on the top again. New Jersey is dropping. New Mexico, New York, dropping. North Carolina is dropping. North Dakota, you're bouncing around off the top after a brief drop. Ohio is dropping a little bit. Oregon, again, bouncing around off the top. Pennsylvania, also bouncing off the top. And we just saw Pennsylvania's hospitalizations were up this week. Rhode Island is dropping. South Carolina is dropping at this time. South Dakota, I hope you're starting to drop. You're bouncing off the top as well. Tennessee is dropping. Texas is dropping. Utah looks like it is peaking at this time. Vermont is finally dropping. Virginia is dropping. Washington looks like you may be starting to drop, as does West Virginia, I hope. I mean, you're pretty high. You're above 4% still. Wisconsin is dropping, and Wyoming has not reported. Alrighty, folks, we covered a ton of stuff within just 20 minutes today. If you enjoyed this video, give it a thumbs up. subscribe down below. Hit that notification bell. Share this video with anyone you know all across social media, friends, family, whoever, and of course leave your comments down below. Remember my website, datareport.info. I'll see you all again next time. Until I see you again next time, stay safe everyone, and have a fantastic Saturday afternoon. Thanks for watching.